My Belizean friends, regrettably, 2 Belizeans have died as a result of the new coronavirus. We mourn their tragic loss and ask for prayers of comfort for their families and friends and for our nation in these trying times. The recent events surrounding their deaths, the testing, contact tracing, and detection have highlighted serious concerns and possible negligence. Here are the facts as have been presented to me by the experts. First, we learned that from March 12th, SICA had offered to Belize no less than 25,000 testing kits, but our Ministry of Health refused. Now the government is scrambling to see if it can get those tests because what we have in stock now is very limited. Second, due to the lack of available tests, testing procedures and testing itself by Ministry of Health through its central medical lab has been grossly insufficient, and there is no community spread of the virus, at least in Belize District and in Cayo District. Third, lack of developed protocols by the Ministry of Health in caring for patients with the coronavirus was clearly evident in the treatment failures with respect to patient 4 who died. Fourth, lack of developed protocols by Belize healthcare partners and Ministry of Health for frontline caregivers and facilities to deal with suspected COVID-19 patients is clearly evident with respect to patient 10 who also died. Subsequently, there are now over 40 healthcare workers who have been directly exposed to a patient who tested positive for COVID-19 at Belize healthcare partners and almost 20 at KHMH. The opposition has been working tirelessly in good faith as part of health, agriculture, and economic committees. We are dissatisfied with many decisions, as we do not believe that our suggestions, based on advice of experts, are being taken seriously at these levels of the process. We have heard the Prime Minister's address to the nation a short while ago. We agree with the decision on the national lockdown. However, we feel it is just not enough. Because of the crisis we face, certain additional decisions need to be taken ASAP. We therefore call on the government to urgently implement the following measures. 1. Immediate and mandatory closure of the Belize Healthcare Partners Limited facility for decontamination. 2. Immediate and mandatory closure of the non-COVID ICU unit of the KHMH for decontamination. 3. Mandatory testing and quarantine at a designated site of all medical personnel and staff exposed to patients who tested positive for COVID-19 and those identified through contact tracing or others who were voluntarily identified. 4. Mandatory testing and quarantine at a different designated site of all non-medical persons exposed to persons who tested positive for COVID-19 and those identified through contact tracing or others who were voluntarily identified. 5. Mandatory testing and separation of all COVID-19 medical personnel and staff from non-COVID medical staff, including provision of accommodation separate from family and others at a designated site. 6. Written protocols must be immediately established in the management of suspected and confirmed COVID-19 patients. These protocols must be publicly disseminated. Training of medical and support staff at major private and public healthcare facilities throughout the country, including regional healthcare centers, must be undertaken immediately. 7. Written protocols must be immediately established for transfer of suspect and confirmed COVID-19 patients between health facilities, especially in the transfer of patients from other facilities to KHMH. Such protocols should include whether patients should remain at the initial facility, taken elsewhere if they are presumed to be positive for the coronavirus, and should also include the level of protection required for staff. 8. Belizeans have lost complete confidence in the performance of the Minister of Health, and the time has come for the Prime Minister to take appropriate action to restore confidence and assurance in our ability to manage this health crisis. As leader of the opposition, I have made this statement after advice from experts and in the public interest. At present, the situation as it relates to food is also a critical one. As seen by the number of applicants for unemployment assistance, many Belizeans cannot afford basic food items at this time. Disturbingly, food distribution is being politicized by and through political arms of the UDP using unnecessary middlemen, while completely ignoring the advice of the opposition and disregarding the farmers' plight in the process. That is unacceptable. For some time now, we have been advocating for a process to be put in place for distribution of food in a non-political manner to those most in need. We believe the Belize Red Cross and the Belize Defense Force are capable of carrying out a food distribution program free from political interference. As we move into another phase of shutdown with even greater restrictions, food distribution countrywide will become even more urgent. Our proposals and suggestions in the various committees are not being implemented. This is regrettable. On the unemployment relief program, our opposition representative has already approved over 10,000 applicants, many of which are the poorest of the poor, the long-term unemployed. The government's representative has approved less than 1,500. This is a callous disregard for the humanitarian need of our suffering people. The public must have trust in the systems established to manage this crisis. As a responsible opposition, we demand transparency and corrective actions now. When I accepted to co-chair the Oversight Committee on this crisis, it was in the genuine interest of bipartisan support for the country's management of this national challenge. It is becoming more evident that politics is finding its way into the decisions of the government, and this cannot be supported. During the course of this weekend, I will continue my consultations and will decide whether we will continue to serve on the committees established to respond to this national crisis. Please remember, we must act responsibly. Stay at home. If you must leave your house, wear a face mask. Practice good hygiene and care for your family and loved ones by practicing social distancing as much as you can. My fellow Belizeans, we pray for God's continued guidance on our nation. Thank you.
We will get stronger, so much stronger.